In our Health Watch now, whooping cough cases in Louisiana are on the rise. The Department of Health has identified 164 cases in just the first 4 months of this year. Now, compare that to last year. In all of 2024, we had 153. There have been 40 hospitalizations since September and 2 deaths. Both were infants. Joining me now is Dr. Joseph Bikini, a pediatric infectious disease specialist with Willis-Knighton here in Shreveport. Thank you for joining us.
My pleasure.
Why do we need to be concerned about the increase in number of cases?
Well, whooping cough is a very serious disease, especially for very young infants. And for anybody that gets infected with with bacteria, the problem is that it causes a respiratory infection with a severe cough. And for many people, that cough is severe enough that they cough in coughing spells, where they start coughing and they continue to cough, cough, cough so frequently that it's hard for them to catch their breath. So that characteristic whoop that's part of whooping cough occurs when someone has had a coughing spell and they've coughed so many times, they're so short of breath that they take this big inspiration, and that causes the noise that is characteristic for whooping cough. The infection starts off as a common mild respiratory illness, which lasts for about 2 weeks. But by the end of the second week, people start to have the cough. And the cough becomes more severe, and the second part of the illness is a more severe cough that gets worse over 2 weeks, reaching the point where they have the spasms, the shortness of breath. People who have it sometimes wake up in the middle of the night, short of breath, feeling that they're suffocating. That's how severe it is. The good news is we have a vaccine, and we have a vaccine to prevent it, and the vaccine is safe, it's effective, but it's the type of vaccine that needs to be given multiple times. So for infants, we start by giving multiple doses, 2, 4, 6 months of age, and then 12 to 18 months of age. And then we give a booster dose at 4 years, 1 for an adolescent, and then all of us need an additional dose every 10 years. And that keeps us protected from severe disease. As we go a number of years from when we've been vaccinated, sometimes the vaccine is not as strong and we have some breakthrough cases, but they're generally milder if you've been immunized and up to date.
How contagious is it if you've not been immunized?
It's highly contagious. And what we know from a lot of studies that have been done is if there's a case in the household, at least 80% of the people in that same household who are not immunized will have been infected by the organism. So it's very severe.
So what are you telling your patients to do?
Well, I think the most important thing we have to recognize is that this disease is most severe for babies, especially babies who are under 3 months of age. In fact, the few cases of people who can die of this disease occur primarily in children under 3 months of age. And unfortunately, 2 children in Louisiana have died in this outbreak of pertussis that we're seeing. So the main thing is make sure you're up to date with your vaccines. We want to make sure that everybody looks at their vaccine records, make sure that they're up to date. If they're not up to date, this is a really important time to get your booster dose, complete your primary series, make sure your child's up to date. For mothers who are pregnant, it's really important. We can't give the first dose of pertussis vaccine until the child is 2 months of age. Younger than that, they don't really respond to the vaccine. You have to wait till they're 2 months. So what we do is we give a dose of pertussis vaccine to every pregnant woman during each of their pregnancies. The importance of that is that mom makes antibody crosses the placenta and protects the baby. And we know from studies that have been done that you can reduce the risk of pertussis infection in the first 2 months of age by almost 80% by giving mom that single dose of vaccine during her pregnancy in the 3rd trimester. In addition, it prevents over 90% of hospitalizations because of pertussis in that age group. And that's the group we're most concerned about.
Indeed we are. Thank you so much for coming and talking more about this today.
My pleasure. Thank you.
All right.